Good morning. My name is Jay McNamara. I'm the clinical specialist for Aerogen, and I wanted to show you how to operate the Aerogen Solo device for use for inline nebulization. Basically, the system itself, as far as hardware, consists of three components. First, you'll notice is the Aeroneb controller. It's marked Aeroneb Pro X. You'll see it has a blue on-off switch on it. There's two options with the on-off. You can go to a 30-minute timed mode, in which case it will turn off on its own after 30 minutes. And you also have the continuous mode, which you achieve by depressing the blue button for 4 seconds, and it will go to the continuous mode. It has to be plugged in order for it to go to the continuous mode, and that's another part of the component. If you look, you can see there is an AC/DC adapter. We recommend you keep it plugged in at all times. It will operate under battery power for about 40 minutes on a full charge, 40 to 45 minutes, but typically that's reserved for a quick transport or if the lights inadvertently go out in the facility. So you'll notice I do have a spot to plug this in. Once I plug it in, you'll see it lights either green or amber. If it's green, it means you're fully charged, and it should be capable of going the 40 minutes unplugged. Again, we don't recommend that. We recommend you keep the plug with the unit. That way you will avoid losing it. If it's amber, it means it's not fully charged, but it will still operate. Again, you'd like to have it plugged in order to do that. In addition to the AC adapter and the controller, we also have what's called the controller cable. This is the cable that actually goes between the controller module and the Solo nebulizer, which is the device you're going to actually use to nebulize your medication. So there's two ends, obviously. One is a circular end, and it's going to plug in right here at the bottom of the controller. And the other end is going to plug into the Solo, which I'll explain to you here shortly. So if you look at when you go to do a treatment, you're going to end up having what's called a convenience kit. It will be a Ziploc bag with 3 items in it. 2 of the items are the devices you'll be using. It's a universal T adapter and the Solo nebulizer. Solo basically infers that it's for single patient use, so it's disposed of after you use it for that patient. But it is good for 28 days, so we'll discuss some options in using it post-ventilation. If you use it continuously, it's to be used for 7 days. There is one other item inside there. It's a lure lock. At this time, you could probably dispose of that. There's another system out there for continuous medication delivery, unless you're directed otherwise by your management. So once you open up this treatment, you will then have these 2 items, the universal T-piece as well as the Solo. And the Solo operates on what's called vibrating mesh technology. If you were to look inside it, you'll see a tiny little disc. And just to demonstrate the technology, I wanted to show you what a vibrating mesh looks like. So this is actually outside of the Solo. So I'm holding a disc here that has the vibrating mesh in it. I'm going to snap a saline and show you basically the aerosol that's generated just with 1 drop. So you could place 1 drop on it. You can see it hopefully against my dark shirt. That there's quite a bit of output with this aerosol. So it literally will do drop by drop technology. So unlike jet nebulizer, there's really no waste whatsoever. This will nebulize down to less than 0.1 ml. So essentially it's going to nebulize almost every drop you drop into it. So that's the technology. The aerosol particle size has a mean of 3.4 microns. A great majority are in that range. All of them are in the 1 to 5 range. The mesh itself vibrates at 128,000 times a second. That's the energy that's sent from the controller to the disc. And there's 1,000 holes in the disc itself. So there's quite a bit of aerosol output. For clinical use, essentially you have the vibrating mesh inside the Solo nebulizer, and if you look inside there you could actually see it. So the Solo, unlike a standard jet neb, sits above the circuit. So it does hold 6 mLs. You would basically open this, drop your medication in, close it, and turn the device on. But I got ahead of myself a little bit. I'd like to explain the best positioning for this. So once you have this in the circuit, whether it's in this position or you have it in this position in another modality, either a mask or however else you determine to use it, you'll notice that the T-piece has a slight angle to it. So if I am going to set this in like this, you can see that my angle towards the vibrating mesh is less than if I was to rotate it this way. Now I have a nice steep angle down. So when I drop the medication in, it's got a steeper slope to go into the vibrating mesh. So we recommend always to have the steepest slope possible. Now if you had this in a different position, say in the circuit where the patient was up like this, you can then rotate this around because it is a friction fit, so you have the ability to rotate it to get the desired position. Once you are in the circuit, you can leave it in the circuit. You don't need to take it out in between treatments, thereby avoiding any loss of PEEP or airway pressure. When you do open the silicone plug to drop your medication in, you will not lose any airway pressure or gas. So basically what you would do is, once in the circuit, and I'm assured my ideal angle, I drop my medication in. Most probably you'll already have this plugged in. And then basically you would just turn the device on and make sure that you recognize there is aerosol production. Now you won't hear anything, and also because it's electronic, there won't be any added flow or pressure. So there's no flow, you're not going to change your FiO2 at all because you're not adding air or oxygen. You're also not changing your dynamics of your ventilator parameters because you're not adding flow, so you're not going to change your pressure, peak flows, or any of that. So you don't need to really worry about expanding your alarm volumes or decreasing your pressure or volume settings. You can actually do a vent check while this is in line, and or a blood gas, because again, we're not changing the FiO2 at all. The main thing is just to make sure that you see aerosolization. The treatment should last anywhere between 5 and maybe 8 minutes, depending on the volume you're using. The main thing is that once you've depressed it once, it automatically went to the 30-minute. So if you're unable to get back, or just basically forget to turn it back off, it will turn itself off after 30 minutes. There is no harm done if it's completely dry and it's still running, so that's not a concern at all. One other thing to keep in mind is because it's good for 28 days, many of your patients are going to be on and off a ventilator within 3 to 5 days, I imagine. So you could also use this because it will be pole mounted with a locking bracket and a basket that will have your supplies with it. Once the ventilator is removed from the room for reconditioning and cleaning, the patient may end up in another modality, be it BiPAP, oxygen delivery by mask, or by cannula. You could actually use this in other devices. So let's say, for instance, the patient is on nasal cannula. You could basically take 50 cc's of dead space, hook it up like this, drop a mouthpiece in it, and now you've got basically a T-piece treatment. You're using the dead space as a reservoir, and keep in mind there is no flow, so if the patient can't inspire, they're not really going to be able to move the aerosol at all. Another way you could use this, if the patient, say, was on a mask treatment, or on mask, either a set FiO2 via Venturi clip, you could take your Venturi, plug it right in line, and then have it delivered. Now again, you can see there's no flow. As soon as you add a little flow, you'll get the aerosol to the face mask. The nice thing about this is you have a known FiO2. You can continue to deliver your known FiO2 and also provide a treatment in line. Just as well, you could take this and put it in line with a BiPAP mask. Most data shows the closer to the mask, the better. So if you could mount it right on the mask, you'll get the best deposition. Also, again, because there's no added flow or pressure, it won't change any of your parameters, and you don't have to take it out of line, diminishing what you tried to gain with your BiPAP or CPAP. I think that's pretty much it as far as most of the information. Just in review, basically make sure you have the best angle with a T-piece, so depending on what modality you're in, you can always move this because it's a friction fit. If you do have it up close to the patient and you want to avoid extra cables, you could always unplug this between treatments and just plug it back in. And then keep in mind, you want to keep this plugged in whenever you're using the technology. Thank you very much. If you have any questions, please reach out to your local representative.